Great, thank you. And so like you said, my presentation will be focusing on men's behaviors after their HIV diagnosis, looking at our qualitative findings from 3 specific fishing villages in Rakai, Uganda. My title is a little different than the agenda because I went a little rogue at the last minute, so just to note that. So our study took place in the rural Rakai district of Uganda, and as you can see on this map, it is located in the southern corner of the country, bordering Lake Victoria and Tanzania in the south. This was the place where AIDS cases were first identified in East Africa. This was back when they were calling it the slim disease because they didn't realize why people were getting sick and losing weight and dying. The Rakai district is home to a mostly rural population, with 95% of its residents living in a rural area, and most of them relying on subsistence agriculture. The entire district is home to about 500,000 people spread out over the lake and the inland areas inside that circle, with about 12,000 people living specifically in the fishing villages. So we were specifically interested in looking at populations within those fishing villages along the banks of Lake Victoria. They're often in very remote locations with very transient populations. As you can see in this picture, the infrastructure is generally pretty lacking. There is often not reliable access to clean water or electricity, and houses are generally built not very well. HIV prevalence is particularly high in this area, especially when compared to the rest of the country. Our own analysis of the most recent data available shows a prevalence among men of 30%, which is compared to a national prevalence of about 6.5%. And then specifically among women in these fishing communities, we've found prevalence around 60%, and among sex workers in particular, around 75%. So the numbers are really kind of staggeringly huge here. Reports of recent alcohol use in these villages is also very high. A recent study showed that over 60% of males who drink reported intoxication at least once in the past month. And also self-reported prevalence of intimate partner violence perpetration, so perpetration of violence against a spouse or a romantic partner, was about 40% for emotional perpetration of violence, 10% for physical, and 4% for sexual. And we know that this is men's reports of their own perpetration, so the numbers of women experiencing these sorts of violence is likely much higher than that. Finally, compared to men who don't drink alcohol, those who do drink alcohol have been shown in these areas to be more likely to use violence against their partner, and drinking in these fishing communities has been associated with other risky sexual behaviors, such as inconsistent condom use, engaging in transactional sex, and having multiple sexual partners. So we decided to focus specifically on these populations in fishing communities because all of these issues are just so high across the board, and they're all really interconnected. So our research aims for this specific study were to look at men's reports of their behavior changes after their HIV diagnosis. This study was a sub-study embedded in a larger study that is examining the relationship between alcohol use, IPV, and HIV, with the aim of understanding the feasibility of creating an integrated HIV, IPV, and alcohol use intervention. So this was kind of just a small study embedded in that. We worked with the Rakai Health Sciences Program, which has been working in Rakai for over 30 years, around the time that those HIV cases were first being identified in the area in kind of the late 80s. They were formed as a cross-national collaboration between organizations in Uganda, like the Ministry of Health, as well as Johns Hopkins and Columbia University in the States. RHSP focuses on services related to HIV, including providing antiretrovirals. They do free circumcisions for everyone in Rakai, and they also conduct research, like we did with them. They are the major provider of HIV testing and counseling services throughout the whole district of Rakai. And so this is the organization that we partnered with to conduct this research. So our methods for this small sub-study were qualitative interviews with 12 men in 3 fishing villages in Rakai. For the study, we specifically looked at questions related to their HIV diagnosis and specifically their behavior changes post-diagnosis. So 2 of the questions we looked at were Up here, when you were diagnosed as having HIV, how did you feel? And were you motivated to change any behaviors in your life? So moderators were trained to probe specifically on behaviors that they changed or took after their diagnosis. So if someone said that they want to live a healthy life, moderators were probed to examine exactly what behaviors that meant. So research participants for this study were drawn from a subsample of respondents who were enrolled in what's called the Rakai Community Cohort Study. The RCCS is a 20-year population-based HIV surveillance study that has been operating throughout 50 districts in Rakai, and it's led by the Rakai Health Sciences Program. So the RCCS has two parts. One of them is a census, which is a short demographic survey delivered to about 28,000 residents throughout the whole district. And then another, a longer behavioral survey that asks more in-depth information about a variety of health behaviors, and as well as biological sample collection. So during the RCCS, every person is asked if they want to be tested for HIV, and if they're found to be HIV infected, they're offered free and immediate counseling post-diagnosis. So our participants were drawn from those who had originally participated in this RCCS survey. So eligibility criteria included being a male, age 15 to 49, having participated in the study, and also having already been diagnosed as HIV infected. So results showed that the average age of the 12 participants was 32 years old, with a range between 24 and 44, and kind of pretty good range throughout that. Levels of education were generally pretty low, with 7 participants not completing primary school. And most men, kind of unsurprisingly, were involved in fishing because we were in the fishing communities, with a few other participants being small business owners, which were probably like selling snacks or food on the streets. And then most of the men were married at the time of the study, with only 2 of them being single. So we found 4 main most commonly cited behaviors post-diagnosis. One thing to note is that we don't actually know when the men were diagnosed as having HIV, so this could have happened a week ago, or it could have happened a year ago. So these behaviors are specifically asking at the moment of their diagnosis and immediately after what they did to change their behaviors. The first most commonly cited behavior change was a decrease in alcohol consumption, with 9 out of 12 men mentioning that. They justified this change because they said that they realized alcohol was affecting their life. A lot of them mentioned that they were forgetting to take their medications because they were getting drunk, so they realized that they needed to stop drinking alcohol, so they would adhere to their medications, and then kind of generally living a healthier life. As we saw earlier, alcohol use is really, really high in these fishing areas. There's honestly not that much to do there. There are a few rows of houses and bars, so most of the men, after they fish, they come and go to the bars. So this kind of makes sense why it was the number one reason, the number one behavior change reason. Men of all ages also cited this as a behavior change, so young men and old men, so it was kind of across the board. The second most commonly cited change was having fewer sexual partners and reducing risky sex by using condoms. Of the sample, most of the men were married, so it's possible that some of the men only had one partner to begin with, so you can't reduce the number of sex partners if you only have one. But it's also possible they were diagnosed before they were married, so this kind of reflects when they were single. Additionally, in Uganda, it's really common to have multiple wives. A few participants actually talked about how they now use condoms when they go to seek other women, as well as using condoms with their wives, because they want to protect their wives at home from HIV and other diseases. So that is a really common practice. The third most common change cited was seeking a better relationship with the spouse and family. This included reducing the amounts that they argue, reducing violence in the home. A lot of them talked about peace in the home. And we found that after their diagnosis, many men felt like they had to rely on their families now, particularly the ones who were quite sick when they were diagnosed. So they felt like they had to work to maintain a better relationship with their family because they knew they were now really going to depend on them. Men also cited their children, that they wanted to be around for their children and they wanted to have a happy home for their children, and they were more motivated to have a peaceful home where they could be supported to take their medications and also get medical help when necessary. And then the fourth most common change was a negative change, which was increasing alcohol consumption. So sometimes this was portrayed as a short-term change. One man said that after discovering I was HIV positive, I continued drinking a lot. Another man said, after I was told I was HIV positive, I went from the hospital to the bar. The one who went from the hospital to the bar later talked about how he decreased his alcohol consumption, so it was kind of a short-term change that he then changed after. It's possible that the men who increased their alcohol consumption were also already addicted to alcohol or were consuming a lot already. But it appears that alcohol can be used as something of a coping mechanism, especially immediately after their diagnosis. So general conclusions, most of the men in our study adopted positive behavior changes, and these behavior changes reflect some of the most pressing issues that we see in these fishing villages, namely alcohol use and violence. And as I mentioned previously, this study was embedded within a larger study looking at the connections between HIV, alcohol, and IPV, which we see in the results are some of the main changes that they want to make and that they do make after their diagnosis. So this kind of gives more fuel to our hope that these issues are interconnected and can be, an intervention targeting these three issues can be effective at reducing these different behaviors. And obviously, more research is needed to understand the prevalence of the fourth change, which was increasing alcohol consumption, to understand whether it's typically a short-term change where they get the diagnosis and they don't know what to do and they just go to the bar, but long-term they decrease their consumption, or whether it's more common among drinkers who are addicted or can't stop and they need some sort of treatment center or rehab center, which really doesn't exist in these areas. And so just kind of what services can be offered for those people. Also, mental health counseling and those sorts of services are really not a thing in the fishing communities in Rakai, so this might be an area for further exploration. So limitations from this sub-study, obviously the findings are not representative of a larger population in Uganda or the fishing villages. Although our moderators for the focus groups were not affiliated with the RCCS, which is that behavioral study that the participants were taken from, it's possible that men could have been biased in their responses and wanted to kind of say what they thought we wanted to hear. And it's unclear when the men were diagnosed with HIV, so it's possible that they were recalling things that they had done many years prior or the previous week before. So more research is needed to understand kind of when that happens and over time do people change their behaviors in different ways. So clearly we need to do further research to understand the prevalence of these actions and how we can work to promote more positive behavior changes and to support those who might be at risk for negative behavior changes. So that's it, and I just want to say thank you to all of the co-authors and to my supervisor, Jennifer Wagman.
Thank you very much, Erica. So we do have a few minutes for questions. Any questions from the audience? Yeah. Could you come over to the microphone in the middle? Sorry.
So, hi, Erica. Hi, Desiree. So it looks like from the quotes that you chose that you picked older individuals' quotes for those that exhibited positive behavior change when demonstrating alcohol use, and younger individuals for those who demonstrated negative behavior change, increasing alcohol use. Did you notice any differences in the demographics between those groups? And would you want to talk a little about how they may possibly be different?
Right, yeah, that's a great question. So for the decreasing alcohol use question, we saw that pretty much across the board. So men who were younger, I think our youngest participant was 24 years old. So men who were younger versus men who were older, they all kind of fell into that category. For the men who increased their alcohol consumption, 2 of them were younger, which would be under 30, and 2 of them were older, which is over 30. One of the men who was under 30 talked about how he initially increased and then decreased. The other one didn't talk about that. So it's possible that there might be some differences. Maybe younger men are more likely to turn to alcohol as a coping mechanism, whereas older men might be able to turn to their spouses or their families. So that's something that would definitely be interested in looking at in the future. Yeah.
Thanks.
Yeah.
Any more questions? Yes.
Not really a question, but just could you kind of recap a little bit of the relationship with the IPV and then the alcohol abuse and its correlations with HIV? It seems to be like a common theme, and especially with the domestic violence that we heard about earlier in
absolutely.
IPV. So could you just recap that a little bit?
Yeah, sure. So it's absolutely true. I mean, especially in these communities where rates of alcohol use, IPV, and HIV are so high, research has definitely shown that they are all very interconnected issues. And if I can, maybe I can go back to that slide. Yeah. So I could give you some kind of literature that actually shows this, but we didn't look at this specifically for this study, but in other studies have shown that there is an association between those 3 factors, that men who are more likely to, men who are intoxicated are more likely to perpetrate violence. HIV is more common among men who consume alcohol at high levels in these areas, and kind of the flip side among women as well. So women in these fishing areas who drink alcohol are more likely to experience violence from their partners and are more likely to be HIV infected as well. So it happens on both sides for different reasons. So that is something that one of the reasons why we want to try and embed alcohol and IPV into this HIV counseling and testing, because they're so interconnected, and hopefully we're hoping at the counseling session that they get after they're diagnosed that they can talk about these issues that are very clearly interrelated, and we can capitalize on that moment as an opportunity to reduce these behaviors in this community because they're so widespread. And it seems like the HIV diagnosis place at that moment is a good time to kind of promote behavior change. So.
Further to that question, I was wondering if you could just say briefly why, as you've mentioned, that the prevalence among women is nearly double that among men. Do you have ideas about why that is?
Yeah, it's actually pretty striking. We were really saddened when we realized that the prevalence was about 60% in just a sample that we're working on for a different study, and 75% among sex workers. These communities are really remote. A lot of times men move to these communities because they need to, send money back home. So there are a lot of men who are in these communities without their families for extended periods of time. Most of the women who are there, I would assume, are sex workers. Sex workers, it's probably the #1 occupation among women there. There's really not much in these communities. It's just kind of a few rows of houses. So the fact that HIV rates are so high is probably a factor of that. The fact that these communities they're so isolated, you can't go anywhere. They're like an hour and a half on a really awful dirt road to the next community. A lot of men without their families who are there for 4, 5, 6 months at a time. So kind of all of these factors together produce these really extraordinarily high rates. And there are 12,000 people who live in fishing villages in Uganda. So it's not a small number of people who are living in these areas. So.
Striking, thank you.
Yeah.
Thank you so much again for an excellent talk.